Hello guys, I'm Dr. Sajjad Pathan and I welcome you all to another video on the Mrcem primary buzzwords. But before we proceed, I just wanted to inform and alert few doctors who are looking for ultrasound courses. There's an ultrasound course coming up which is run by my colleague. It will be run in Frimley. It's on 5th of June. If you guys are interested, you can pause the video and take a screenshot. And it's very easy to register on pocusfrimley.org. So, or otherwise, if you have any issues, just leave a comment below and I'll be happy to assist you with that. And yes, I'm teaching on this course. So let's go ahead with the primary buzzwords. ACE inhibitor, cough and angioedema. ACE inhibitor leading to cough and angioedema. What is the mechanism? And that would be your bradykinin mediated. ACE inhibitor, cough and angioedema is bradykinin mediated. Ketamine contraindications. Ketamine contraindications. This would be your eclampsia, preeclampsia, head injury and hypertensive emergencies. Ketamine contraindications: eclampsia, preeclampsia, head injury and hypertensive emergencies. Dermatome at xiphoid process. The dermatome at the xiphoid process, it is your T6. T6 at xiphoid process. Aortic openings: vena cava, esophagus and aorta with thoracic duct. Remember Voice of America: vena cava, esophagus, aorta, thoracic duct. That would be your T8, T10, T12. Ketamine mechanism of action. So ketamine mechanism of action is your NMDA receptor blockade. Diazepam mechanism of action. This is a GABA agonist. GABA agonist. Diazepam. Lignocaine mechanism of action. Lignocaine mechanism of action is, it is sodium channel blocker. Sodium channel blocker, lignocaine mechanism of action. Lignocaine toxicity, what antidote can we give? If we have a patient with lignocaine toxicity, what antidote can we give? We give them intralipid emulsion. Intralipid emulsion. INH toxicity, isoniazide toxicity. How would they present and what would be the treatment? INH toxicity usually presents with seizures and the treatment is pyridoxine, which is your B6. Which vitamin deficiency can occur in hyperemesis gravidarum? Which vitamin deficiency would happen? And that would be your thiamine deficiency. So I can link over here thiamine deficiency with Wernicke's encephalopathy with hyperemesis gravidarum. If they give a female pregnant lady in her first trimester coming in with confusion, ataxia, nystagmus, likely they are pointing out towards Wernicke's encephalopathy secondary to thiamine deficiency. Again, Wernicke's encephalopathy, that's your confusion, ataxia, nystagmus, ophthalmoplegia. Give them thiamine. Wernicke's encephalopathy is a combination of can, confusion, ataxia, nystagmus of beer, can of beer. So confusion, ataxia, nystagmus, ophthalmoplegia, give them thiamine. Ascending paralysis and loss of deep tendon reflex. Ascending paralysis and loss of deep tendon reflex is associated with Guillain-Barré syndrome and commonly associated with Campylobacter jejuni. So patient with vomiting or diarrhea comes in later on with ascending paralysis. That's the classic one. Diuretics site of action. Where do these diuretics act? So I've made a mnemonic there called MALTS. 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 Mannitol acetazolamide, loop diuretic, thiazide diuretic, spironolactone. You need to remember that in order. You know, malt is the grain which is used to make beer and beer causes diuresis. So malts, you should remember. Mannitol acetazolamide is proximal convoluted tubule. Loop diuretic is the thick ascending limb. Thiazide is distal convoluted tubule and spironolactone is the collecting duct. So you got to remember it in that order. MALTS, proximal, thick ascending limb, distal convoluted tubule and collecting duct. ADH mechanism of action. ADH mechanism of action, that's aquaporin induced water reabsorption. Aquaporin induced in the collecting tubule distally. Furosemide mechanism of action. Furosemide acts on the thick ascending limb, which it's a loop diuretic. So it blocks sodium potassium chloride co-transporter. Furosemide side effects. Furosemide side effect, that's your hyperuricemia. Remember, furosemide started to a patient and they come in with gout. So hyperuricemia is one of the things. You need to remember that. Thiazide side effects. Thiazide side effects have been tested so many times. Thiazide side effects is a potential question. And you got to remember, I made a mnemonic over here called as hypergluc, which is hyperglycemia, hyperlipidemia, hyperuricemia, hypercalcemia, hypochloremic alkalosis. Ampicillin induced rash in upper respiratory tract infection. So somebody had an upper respiratory tract infection and the doctor gave him ampicillin or amoxicillin and they come up with a rash. That's your infectious mononucleosis, Epstein-Barr virus, or some people call it glandular fever. Infectious mononucleosis caused by Epstein-Barr virus. Adrenal zones, cortex. Adrenal zone, cortex, that will be a zona glomerulosa fasciculata reticularis, GFR, glomerulosa fasciculata reticularis. And what do they make? They make aldosterone, steroids, and sex hormones. So salt, sugar, and sex. Salt, sugar, and sex. Glomerulosa fasciculata reticularis. Adrenal medulla. Adrenal medulla produces catecholamines. Gout treatment. Acute, what would you use? And in chronic, what would you use? It would be in acute, use colchicine. In chronic, use allopurinol. So if you see, notice AC becomes CA. For acute, colchicine. Chronic, allopurinol. I think that's all for this video, guys. If you are liking this video, please do hit the like button and write in a comment below. Do share the video with your colleagues, and happy studying. Good luck with your exams and stay blessed and peace.